Okay, good afternoon, everyone. I'm Haya Dugan from Ethnic Communities Councils of Victoria, and I'm happy and proud to present to your community, the South Sudanese community, our presentation about the COVID-19 and vaccine hesitancy. First, before we start, I would like, so next slide, please. Can you start? Yep, the other one. Second one, yep. So before I start, I would like to introduce acknowledge the people of the country we live in on, and in the spirit of reconciliation, the ECCV acknowledges the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay our respect to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islanders peoples today. Next one, please. So first, I would like to talk a little bit about ECCV. The Ethnic Communities Council of Victoria is a member-based peak body representing the independent voice of multicultural Victoria. Since 1974, ECCV has been advocating for human rights, freedom, respect, equality, and dignity for migrant and refugee communities. We strive to strengthen and build capacity in our communities through advocacy, policy, and leadership, empowering people from culturally diverse backgrounds. Our vision is to build a culturally diverse and harmonious society that is just, fair, and inclusive for all Victorians. Next, please. This housekeeping rules doesn't apply tonight for our audience because we're live on Facebook. So let's move to second slide, please. I will tell you a little bit about the community outreach program, which I'm currently coordinating with another team member. We are a team of community bilingual workers from various ethnic backgrounds. Our aim is to engage and support people from CALD backgrounds impacted by the COVID-19 pandemic, and to empower members from multicultural backgrounds to make a well-informed decision about the COVID-19 vaccine. Next, please. The content of this presentation, first we have our guest speaker, and also we have a community member I will introduce to you later. Presentation from guest speaker, question and answers. This is a very interesting section in our presentation because it gives you the chance to ask any question you have in your mind related to COVID-19, the safety, vaccine safety, any question. Don't feel shy, even if you think this question is not important. It is important if you think in it. So please ask, and our guest speaker will make sure to answer all your questions. And second one, please. Okay, before I introduce our guest speaker, Mohammed, I will introduce to you Tuch Ajak. Can you stop sharing so we can see Tuch? Yes, Tuch Ajak is a community leader from South Sudanese community. And I'll leave it up to you, Tuch, to introduce yourself.
Okay, thank you everyone. Thank you Ayat and the team from ECCV, and thank you Mohammed for making this possible. To our viewers outside, today it's information session day targeting the South Sudanese community. As you have all seen the impact of the COVID-19, it's seen the start of the pandemic. There's been a lot of informations out there and a lot of awareness happening, and now comes to the time of the vaccinations, and we're here bringing to you as the community that if you have any question that is making you to be hesitant into taking vaccine, and then you are free to ask, and we will also answer you. Mohammed is here from the health department. So our main missions of today is to have the information sessions to learn, for us to come together, share our thoughts together, and understand much about how the vaccines work, and also encourage ourselves that we take the vaccines. As you have all seen that once, as you've seen, that for us to come out of lockdown and for us to be free and go back to our old normal life again, it's always important that we have to make a decisions. Then that decision is what will help us, and that decision is when you make a decision to take the vaccine. So I'm calling upon all of you South Sudanese communities who are viewing online, wherever you are, tune to us, listen to us, and this video will be recorded and you can still listen later on. If you have any question, feel free to send it to me, or you just comment on our video and I will pick up your questions and I will put it forward to Mohammed and the rest of the team that is here, and they will get back to you. Thank you all, and I wish you a great day, and I wish you that you stay with us throughout our session and feel free to interact with us, and thank you so much. Back to you, Hayat, and the team.
Thank you very much, Tut, and thank you for caring for the community. And also, I would like to introduce you before Mohammed. We have Aurora from the Department of Health of Victoria, and we have our team to support us, the IT team, they're the professional. We have Natasha and Zoran. And now back to our presenter, Mohammed, our guest speaker, Mohammed Mohiddin. OAM is the head of Priority Communities Engagement in the COVID-19 vaccination program. Mohammed is a microbiologist, professional member of the Australian Society of Microbiology. He has also been an academic in the Department of Microbiology, Monash University, for over 20 years. So he knows really what he's talking about. This is the meaning of it. He is originally from Sri Lanka and has been the immediate past president of the Islamic Council of Victoria and is also the current deputy chair of the Faith Communities Council of Victoria. He is a recipient of the Order of Australia and is a current Justice of Peace. Back to you, Mohammed. The floor is yours. We're all okay.
Thank you, Hayat, for the warm welcome and for organizing this event, and also to the ECCV for putting up this event as well. I would also like to thank Tuk. I think your words are very important. I think the message is very clear that we are all in this together. We are not separate. We are all one big family of Victoria, which need to look after one another. May I begin by acknowledging the traditional owners of the land we meet on and pay my respects to the elders, both past, present, and emerging. This land is a land of the First Nations people, and we will always acknowledge their contribution and their rich heritage. So I'll begin by my talk. Just before I start, I just want to emphasize that we are presenting this information to give you and build up confidence about the vaccines. We are not trying to force you to take the vaccines. We are trying to talk to you about the safety of getting vaccinated, and especially reducing the spread of this infection and keeping the community safe. So please take that as part and parcel of our discussion, and we can have a very respectful discussion, and I'm happy to answer any questions at the end of my presentation. So just to give you an idea, I think we all know about COVID, but sometimes it's always useful to talk about COVID. Sorry. So I'm trying to just switch off this. I got all the, yeah. So COVID is a respiratory illness. Many people who get COVID will have a very moderate to mild illness, and they will recover. So that's why sometimes people take this for granted, thinking it's like the normal flu or just any other common fever. But in some people, this can lead to complications. And one of the most common complications is pneumonia. So when you get pneumonia, what happens is fluid builds up in your lungs. And if it gets worse, you're going to find it difficult to breathe. So when that happens, you have to be taken into hospital. You are given oxygen. Things might get worse. And if things get worse and you're finding more difficult to breathe, you will be taken into the ICU, you'll be put on a ventilator. And in some cases, people will be put in induced coma so that they can be comfortable, so that they can keep breathing with the intubator as well. Sometimes, and in some cases, the virus can cause damage to your lungs and other organs. And I'll talk to you in my next slide about what's called long COVID. This is what happens to people after they have recovered from COVID. They still have the after effects of COVID as well. We also carry a lot of microorganisms in us. And when we carry these organisms, when viruses target us and damage cells in our body, these microorganisms that are present in us can cause secondary infections. So this is called superinfections, and this is sometimes common with viral infections. Now, the virus is spread through droplets of saliva or discharge from the nose. This is why when you get a common cold or you have the flu, if you sneeze and cough, people ask you to cover your nose and mouth. It is very common courtesy that occurs where you stop the spread of these viral particle in droplets. So with COVID as well, when people do get this and when they sneeze and cough, if they don't cover their nose or mouth, they will be spreading these particles of viral particles in the environment, which people unfortunately might breathe in and get infected. So this is why we are strongly, and in the government has made it mandatory that you wear a mask when you go out or when you are in a building as well. Because what it does is, if you are infected, you stop the spread of disease going from you. If you're healthy, you come across a person who's infected, it will also to a certain extent prevent those viral particles getting into your respiratory system. Now the virus takes about 2 to 14 days before you see symptoms. Since the day of infection, the virus goes into your body, it starts multiplying, and then subsequently it starts causing the illness itself. So some people will show it within a short period of time, but some people can take up to 14 days. This is what we mean by the incubation period, that the time between the virus infecting you to the time that the virus manifests itself in the disease itself. So this is why if you have gone to a site where a person who is sick with COVID has come, that's referred to as a tier 1 site, and you are then considered to be a primary close contact. You're asked to test and quarantine for 14 days. So you get tested on day 1 and you get tested on day 13. And if you are negative, then after the day 14, you'll be allowed to leave home. But if you're positive, then you will have to stay until you feel better, and then you test again and you're declared all clear, then you can leave. Some people can be asymptomatic as well. Now, just to give you some, sorry, this happens all the time. Sorry about this. So just to give you some rough idea, this is the latest stats as of today. There have been over 223 million cases worldwide. And sadly, about 4.6 million people have died. So the rate of death here is very high. Some people might consider, oh, Ebola is worse than this, or some other disease is worse than this. We have not lost so many people as we have lost to COVID. In Australia, we have had to date 69,911 cases. We have had 1,076 deaths that have occurred as on to this morning. So it's important to understand this is a severe infection. This is very contagious and it can spread very easily to people as well. Now, this is what I mean by long-term COVID. When people, after they have recovered from COVID, they can still have some side effects and have some problems, breathing issues. And we know some of the young people, especially who have come out of COVID, are still suffering post-COVID effect, that if they even try to do too much of exercise, it affects their breathing as well. People have shown heart problems. There's kidney damage because, as I said, it can target other organs apart from the lungs. We've seen neurological damage problems as well in some people, and also there's autonomic nervous system. So these are some of the side effects of COVID. So it is important for us to understand COVID is not just a simple flu that some people take it to consider it as well. So when we talk about vaccines, we must remember that vaccines are not the only answer. It's one part of the answer to keep you safe and prevent COVID from expanding. This is what we refer to as COVID safe behavior. So we have spoken about wearing the masks. and making sure you protect yourself. We also ask you to wash your hands or use sanitizers constantly when you go out, especially when you go to the supermarkets. You know, now at the entrance of the supermarket, they have that big dispenser which supplies you with hand sanitized tissue. Use that to wipe the surface of those trolleys we use, because you never know who's been there before you. And this is what we hear. Sometimes we get a phone call saying the supermarket you visited is a tier 1 site. You need to get tested. So that person could have been a person who's come, who's touched his nose and all that, and then touched the surfaces of those trolleys. And if you don't clean it, you could, by touching those surfaces, you could also pick up the infection as well. So it's important for us to take as much care as possible. When you go to any shop, whether it be a little shop to buy your newspaper or milk, or you go to the supermarket or large stores, or you go to your, at the moment our places of worship are closed, but when they do open, we need to QR code. The reason for QR coding is not to police you and monitor your movements. It is there to help the contact tracers, and some of you might be already working in this area, that they will be able to check who's been there between the time, maybe 2 hours before, 2 hours after, when the person who was infected was there. What happens is you immediately get a call once they have found out that an infected person has been there. It might be in a day's time. You get a text message saying you have been to a site that has been identified as tier 1. You need to get tested and quarantined. So this is the role of the QR coding. So it's very important. You might think it's a problem, but please do QR code wherever you go. Now, when you do QR code, you test and you remain. So testing is important. We all get tested very frequently these days. Now, just to give you some idea, the symptoms of COVID can be very similar to symptoms of the flu. And we are now in spring, we are in hay fever season. People who have hay fever suffer a lot by sneezing and coughing and all that. You have a remedy for hay fever. So if you do see that it's continuing, please get tested. So symptoms like sore throat, cough, runny nose, shortness of breath. In the case of the flu, you will have fevers and chills and sweat as well, like COVID. In COVID, the specific one symptom, which is not in others, the loss of smell or taste. So if you do have these symptoms, do not wait until you're seriously ill or wait for day 3, day 4, day 5. From day 1, get tested. Because if you don't get tested, you assume you're not having COVID. You might be in the community, happily spreading it to other people unknowingly. So it's important that we take the responsibility, not only on ourselves, but also on our families and community, and get tested when you have to. Now, the state government is offering some compensation for people who might have a loss of income when they have to test and quarantine. So if you are testing and quarantine, just if you've been to a tier 2 site, just until you get the results, you can apply for special hardship payment. If you have loss of income, you can apply for the hardship payment of $450 through the Centrelink. If you have to quarantine for 14 days, you can apply. There's a payment of $1,500 available. Again, this is they will check with you. They will find out whether you have really lost income, like you have been unable to go to work, so you cannot get paid if you're a day wage earner. So then they work it out, and then you will be eligible for the $1,500 as well. Now, the federal government, the Australian government, has decided that testing and vaccination is free. There's no charges for either one of them, whether you be a citizen, a resident, a tourist who is here on holiday, who might have been visiting family, or an international student, or even a refugee. Every single person on Australian soil will be given the test and the vaccination free. Now, just to give you some information about our last few cases, as at 12 noon today, we have 2,793 active cases. In the number of people in hospital, 89% of the people in hospital are not vaccinated. 11% of that hospitalized people have only had one vaccination, one dose. And there's not a single person who's fully vaccinated in hospital. So you can see the advantages of getting vaccinated and also not getting the full-blown disease as well. Now, in Australia, we have given out 22.1 million doses of vaccine as of today. And in Victoria, 5.7 million doses have been given at this moment. If you look at the world stats, about 5.64 billion doses have been given. In Australia, we have 2 vaccines. Worldwide, there's about 17 vaccines available. And worldwide, at least 41.5% of the population has had at least 1 dose. Now, if we were to look at the disease itself, the disease is caused by a virus called the coronavirus. It's called COVID or SARS-CoV-2. It belongs to the family of coronavirus, which was SARS. Remember, a few years ago, we had SARS, and we had also in the Middle East, we had a thing called MERS. They all belong to the same family. The unique property of this is they have a structure, which is the crown, like a crown, which are the spike proteins as well. So today we have 2 vaccines available for Australian public. We have the Pfizer vaccine, or referred to as Comirnaty, which is an mRNA vaccine. Now, mRNA vaccines are not new to the world. mRNA vaccines have been researched way back since 1961. And the last mRNA vaccine was the vaccine that was given against Ebola in Africa. The other vaccine that is available at the moment is the AstraZeneca vaccine, or referred to currently as Vaxzevria. Now, this is your traditional vaccine, whether people who have taken the flu vaccine or people who take the, our childhood immunization. Most of them are based on this traditional method, where we use a different type of virus strain, or we can, if it's a bacterial infection, we use a bacterial strain, which is not harmful. We incorporate the genetic material in the cell, and then this is injected into you as a vaccine. So what both vaccines do is they help the body understand and produce the spike proteins. So when they do produce the spike proteins, the body immediately, immune system starts activating, and they are able to fight back and destroy the spike proteins. So these spike proteins will easily get destroyed. They are not producing viral particles, just the protein itself. So then this information remains in your memory. And when the memory, if you get infected, the memory itself kickstarts, the immune system works, and it produces the antibodies which targets the virus. So this is how it works. And we are able to overcome and fight this. Now, just to give you some information, no vaccine in the world can give you 100% immunity. So after the second dose for both these vaccines, we will have about 90 or 90+% of immunity. So we can still get infected by the virus, but if we do get infected, we don't get the full-blown disease, which an unvaccinated person will get. So that's important to understand, that it is not a foolproof method. So we also, Australian government has purchased 2 other vaccines, and they are, one has already been approved. It's called Moderna. It's also, the commercial term is Spikevax. It will be here by mid-September and will be available for Australian public by end of this month. It is also similar to the Pfizer vaccine, and it will act in the same way. We also have purchased Novavax, which we should get by end of the year or early next year, and that thereby next year we should have 4 vaccines available for the Australian public. Now, I just wanted to show this picture because yesterday at the session I ran with the community, people were very wanted to know how the vaccines work. So as I mentioned, you are injected, for example, with the Pfizer vaccine, you are injected with the mRNA. The mRNA then produces the spike proteins, the body produces the antibodies, then this remains in your memory, and then it activates when you do get infection. Now, in the case, as you can see, AstraZeneca, it's another strain of a virus is injected that results in the production of antibodies, and those antibodies then target the spike proteins, and thereby they will be there in the memory as well. Now, viruses are very good in undergoing changes, and this is what we are seeing. We are seeing mutant strains of the virus, and so mutant strains of the virus. And today we have about 11 different strains of the original strain of the COVID virus. Initially, they were named by the country where they manifested, but 2 months ago, WHO made a decision to name them by the Greek alphabets epsilon to delta. Today, there are 4 strains of concern to the WHO from alpha, beta, gamma, and delta. Alpha was a strain in the last lockdown, somewhere in July. Alpha was a strain we were dealing with. Today, the world over is dealing with the delta strain. Now, the delta strain is more contagious than the original strain we had. With the original strain, if one person in the house got COVID, you could isolate the person and the rest of the family might not get. But with this delta strain, what we are seeing, it spreads so fast, just fleeting a person passing by, you can get infected. The whole family tends to get infected as well. We also see children getting infected. 85% of the people who have got infected are below the age of 50 years at the moment. There's a lot of young people getting infected as well with this delta strain. The good news is both vaccines are effective against all these strains that we have at the moment. So with all vaccines, you can have some side effects. They can be mild, they're mild side effects. They're very common in most vaccines. You can have pain in the arm that you had the vaccination. You have tiredness as well. Some people will feel tired. Some people will develop headaches as well for a day or two. Some people will have aches, and some people, a low percentage, might have fever. This is very common in many people. So in Pfizer, it is seen normally after the second dose. In AstraZeneca, it is seen after the first dose. Some people might not have any side effects, and I am the best example. I had AstraZeneca. I purchased all my Panadol and everything I needed, thinking I was going to get one of these side effects, but I had no side effects. I took my second dose, I had no side effects. So some people will have no side effects. So if you do not get any side effects, don't be concerned. It is our way our immune system works. Young people tend to get these side effects much faster and sometimes more sharper, but in older people, it tends to be less because our immune system tends to start dropping as time goes by. Now, one of the key things, one of the strong adverse side effects that can happen, it's again very rare, 4.7 per million doses in the case of Pfizer and 1 per million doses in AstraZeneca, is the anaphylaxis reaction. So anaphylaxis reaction is a severe allergic reaction, and the best comparison I can give you is peanut butter. We know some children, some people are allergic to peanut butter. If they were to take any product with peanut butter, they would have an immediate reaction, and this reaction normally occurs within the first 15 minutes. They might find the swelling of their throat area. They might have hives and all that, and same thing can occur with regard to these vaccines. So this is why when you go to get vaccinated, we ask you to remain at the surgery or when you go to mass vac site for 15 minutes under observation. So if you do get the anaphylaxis reaction, this occurs within the first 15 minutes. So there's medical personnel available to support you. And if you need to go into hospital, make arrangements so that you are given proper care immediately. Now, lots of people talk about AstraZeneca and the blood clots. This has been blown out of proportion. Again, this is a very rare effect. It's called thrombosis with thrombocytopenia or TTS. Again, this is very rare. Today we understand it better. The doctors are able to identify it better, and you are also given this information to sort of if you get any of these symptoms, to be able to seek medical attention, like chest pain, swelling in your legs, persistent abdominal pain, tiny blood spots where you had the vaccination, shortness of breath. And normally you see these side effects starting to occur. And if your general side effects continue beyond the day 4, and it can manifest within up to 30 days, please go to the hospital and seek medical help. Now, if we were to compare clotting due to the Astra vaccine and clotting due to COVID, from the vaccine, it's about 0.0004%. You can get clots due to COVID itself, which is about 16.5%. So if you were to weigh the advantages of getting the vaccine and prevent you from getting COVID and also getting clots, it's much higher than getting clots due to COVID. So this is why it has been blown out of proportion. It is very rare. It can occur. We are not saying it doesn't occur. It occurs in Australia. Over 10.2 million doses of AstraZeneca have been given. AstraZeneca at the moment is being given in over 181 countries. We have had over 70 odd cases. And out of that, unfortunately, about 8 people passed away, 6 women and 2 men. So again, it is important to understand this is a rare thing. We know it is there, but we understand the symptoms and we know the doctors can treat you and get you back to normal as well. Now, with Pfizer, there have been incidents of myocarditis and pericarditis, especially young men under the age of 25. They have experienced this. Myocarditis is the inflammation of the heart muscle, and pericarditis is the inflammation of the sac surrounding the heart. Again, this is very rare. This is not normal. These symptoms occur in days 1 to 5. It can be chest pain, pressure or discomfort, shortness of breath, irregular heartbeat, skip beat or fluttering, pain with breathing, fainting. So again, if you have any of these symptoms after vaccination, please seek medical help. No one has died due to this condition. So please seek help and you can be provided the necessary treatment as well. Now, one of the key things is about pregnancy and vaccination. Even this morning, you had the Chief Medical Officer of Victoria urging pregnant women to get vaccinated. Because if pregnant women get COVID, it can be very severe. They can end up in hospital. They can end up in ICU. They can also have stillbirths. They could also have the baby, if is born, could have to be immediately put into the ICU as well. So the vaccine will prevent most of these dangerous things happening. So we strongly recommend that during any stage of pregnancy, that people get vaccinated, and Pfizer is the vaccine of choice. So you can get vaccinated. Please talk to your doctors and organize for the pregnant women to get vaccinated. We also have found scientifically that the vaccine provides indirect protection to babies by transferring antibodies through the placenta for pregnant women or through breast milk for breastfeeding women as well. Now, as of 24th of August, every single person over the age of 16 is eligible to get vaccinated. Children between the age of 16 to 18 are only given Pfizer. Anyone over 18 can either take Pfizer or AstraZeneca. If they plan to take AstraZeneca, they can, especially the young people, they can talk to your doctors and you will have to sign a consent form if you want to take AstraZeneca. People over 60 and above are only given AstraZeneca unless they have some certain conditions. If you go to the website, you'll find those conditions. Or if they get a very severe reaction to the first dose, and that might be dangerous for them to have the second dose of AstraZeneca, they could, through their doctors, apply to the specialist immunization services and get the vaccine changed. Children between the ages of 12 to 15, it is been approved that Pfizer is the vaccine of choice again. At the moment, we have been vaccinating children with specified medical conditions who are at risk of getting COVID, who have severe asthma, diabetes, obesity, cardiac, and other disorders as well, and also children of Aboriginal and Torres Strait Island children as well. The good news is from Monday, all children will be eligible to get vaccinated. All children between the age of 12 to 15, not children below the age of 12 and above, will be eligible to get vaccinated, and they can book an appointment to get vaccinated from Monday. At the moment, we are also doing a blitz of vaccinating year 12 school kids because we know they're going to be sitting for their exams very soon. So from the 7th to the 19th, all school children have priority booking. There's a hotline given to them by their 2 schools, and they can ring that, make the priority booking, and get vaccinated. The teachers also who are involved in teaching year 12 kids, and also the supervisors who are managing the exams, are also eligible to get vaccinated at the moment. Now, There are over 60 vaccination sites that people can go across and get vaccinated. You can make your appointments ringing the portal site or on portal.cvms.vic.gov.au or call the number 1-800-675-398. I know sometimes it has been frustrating that you might have to wait for a long time to get through, but there's a lot of people at the moment due to this outbreak wanting to get vaccinated. So they're all trying to get through. We have put more staff at these call centers. Again, we have heard that people have rung up and they have been told there's no booking. There is plenty of bookings available right across. You need to try various options, and you can see even on Facebook or in various others that people are talking that they couldn't get a booking at this particular site, but they got a booking at another particular site. So all the sites are listed, so you can check about the other sites as well. You can also go to your GPs or GP respiratory clinics. If you have your Medicare card, you can get vaccinated from them. People without Medicare card need to go to a state government-run vaccination site to get vaccinated. If you are unable to leave home for some reason because of some health issues as well, so you can ring the disability liaison officers. We will share these slides with you. There's a form that you can fill, and you can organize for them to come and vaccinate the person at home as well. Now, when you make an appointment for vaccination, it's important to understand some of the precautions you need to take. If you're feeling unwell with fever, cough, or runny nose or other symptoms, you should not be going to the vaccination site because you do not want, if by chance you have COVID, you do not want to infect other people there. If you're waiting for COVID test results, you should not be going out of the home. You're supposed to be isolating at this stage. You should not be visiting a vaccination site. If you have tested positive, you are now isolating for 14 days and in quarantine. So please do not make bookings and go to the vaccination site during your infection time. If you have been a close contact, you're considered to be a primary close contact again. You should be quarantining at this moment for the 14 days. You should not be going to the vaccination site as well. The vaccine is not a treatment. It's not going to reduce your COVID. So it's important for you to understand that if you are one of these people, that you should not be going to get vaccinated at this stage. If you have no problems and no issues, you don't need to test for COVID before going to get vaccinated as well. Now, we are working with the community, and this is what we are reaching out to the community to talk to you, to build up your confidence, and also talk to your leaders and community faith leaders as well, because you are the best voices. Your voice is strongest. The community trusts you, and they're going to listen to you. So please, we want to work with you, and we are running various training programs. We have a vaccine champions program where we invite people from the community to be part of that. You are most welcome to join us, and we can train you. We can give you the information so you can talk to your community. We want you to be able to talk to your community. We don't want you to be harsh on the community. We know some people are vaccine hesitant. There's a lot of fear. So sometimes fear makes people not want to take the vaccine. So we need to be able to talk to them, be gentle with them, and get the message across, because we want you to be confident that this vaccine is safe. This vaccine will help you as well. So we want you to do that. We also want to hear stories from people who have got vaccinated. We hear some of these fantastic stories where people have got vaccinated and they have supported us in getting the message to us. We're also trying to address some of the misinformation out there. There's a lot of misinformation by anti-vaxxers. Especially these days, they are finding that they have been marginalized. There's less of them. There's more people wanting to get vaccinated. So their voices starting to get louder and louder. So please do not listen to them. They do not have the background or the knowledge to give you that information. If you need the information, talk to your doctors, talk to scientists or the nursing profession. They all know that they are dealing with COVID patients on a day-to-day basis. Or if you want to look at some reputable sites, go to the Department of Health, either in Victoria or national, or go to the WHO site or even the American CDC site. You'll find very accurate, scientifically supported information on these sites as well. Now, why do we need to get vaccinated? I've given you all the information about the vaccines, but I'll sum it up in just about 7 dot points. The vaccines are effective. They can keep you from getting COVID and spreading. So many people who have been vaccinated are safe. They're not, but some people, as I said, will get infected. If, there's no 100% foolproof. By getting yourself vaccinated, you are able to, if you won't get the full-blown disease. If you do get, you'll have a mild attack. You won't need to be hospitalized, or you don't need to end up in ICU. It is important to get both doses. So there is a time interval that we say that for Pfizer and AstraZeneca at the moment, it's 6 weeks apart. Initially, they have a different time limits given. Initially for Pfizer was 3 weeks, for AstraZeneca was 12 weeks. But what we are trying to get is more people vaccinated at the moment. So that's why we have extended the Pfizer to 6 weeks. And AstraZeneca, we are in a COVID outbreak at the moment. So we are trying to get more people fully immunized as well. So both vaccines are effective after the second dose. You get over 90%. The first dose will give you up to about 70-odd%. The second dose will take you up above 90%. So it's important to get vaccinated. Again, there's this false rumor out there that the COVID vaccine will give you COVID. As I showed you very clearly, the vaccine has no virus in it. So it cannot give you COVID. It's not going to make you sick. It's not going to make you better. So the vaccine is used as a preventative measure, not a treatment. So scientific evidence has also shown that the vaccine prevents people who are infected and prevents the virus from mutating in people who are infected. So we don't have the new strains that are coming now. We have 11 strains. We heard there are another 2 strains that are come out. So that's just happened. Now the vaccine is not a tablet. It's not a tablet like if you have a headache or pain, you can take a tablet and within a few hours you feel better. The vaccine makes your immune system work. So it takes about 2 to 3 weeks from the first dose for your immune system to build up. And once that has been built up, it will be there for some time. It's in your memory and your memory kickstarts. So it's important to understand you don't wait until the last moment where your neighbor has got COVID or somebody in your family has got COVID before you rush to get vaccinated. Please get vaccinated as soon as possible. Whenever you get the chance, get your vaccinations done. If you're already infected, as I mentioned, the vaccine will not work against infection. With COVID, there is no treatment. What the treatment we offer in hospitals is to keep you stable, because you are going to find, if you end up in hospital, you are going to find difficult to breathe. You are having lack of oxygen. So they put you on oxygen. Even in the ICU, they're putting you on oxygen. Like in some severe cases, they will put you into an induced coma. So they keep you stable. So your body is stable because they're trying to keep you as comfortable as possible and get your immune system to work. We have no antibiotic. No antibiotic works against COVID or any viruses. There's no treatment at this moment except to keep you safe, keep you comfortable so that your body immune system works, produce the antibodies, and you will subsequently recover. Some people have lasted in hospital for 90 days when they got COVID. I remember last year, we spoke about this 92-year-old man who remained in hospital for nearly 3 to 4 months, and he recovered. He was given the hospital care and he came out of it well as well. So it's important to understand that it is your body system that will work, but you can get severely ill as well. So if you have had COVID, we suggest that you wait for 6 months because when you get COVID and you recover, you have antibodies that have been produced to fight the virus. So that antibodies will last for about 5 to 6 months. So we recommend you wait until that period and then get vaccinated. There's no problem getting it earlier, but ideally would be to wait for 5 to 6 months before you get vaccinated, because the vaccine is not only targeting the strain that you got infected, but also targeting any other strains that you can get infected by. So again, to end, there's over 5 billion vaccines given. It is safe, it's constantly monitored. If you have any questions, talk to your GP. They are the best people to answer and help you if you have any other health issues. And please check the correct information that's out there. Don't get carried away because X or Y tells you this. We hear, because we are mostly from Cal community, we have our family and relatives and friends all overseas as well. Sometimes you get information from some countries which might be not correct. It might be false information again. So please try and get the correct information at all times. thank you very much. I'm going to stop here now. The Premier announced that within 5 weeks, he wanted 1 million people to get vaccinated. We are on the right track to get this vaccination done. We want to get every single person. Today, we have a large outbreak. We had over 450 cases. Many of them were in certain suburbs, like you've seen in Hume and the western suburbs. Majority of the cases were in those areas. We need to get most people vaccinated. We are trying to get as much vaccines in. We are trying to have more pop-up sites. We are using as many resources as possible to get you vaccinated. Thank you very much. I'm happy to take any questions.
Thank you very much, Mohammed, for a very, very informative presentation. And we appreciate you giving your time on Saturday, you and Aurora, to be with us and to answer questions from the community. I've had a question on my Facebook because I shared this on my Facebook page, and a lady was asking about the children. She's concerned, like now at school, they said they're gonna give the vaccine to their children. And she's thinking, oh, she doesn't wanna do it. She doesn't wanna have children, have children taking the vaccine. So what is your input on this?
Thank you, Hayat, for that question. It's an important question. Children above the 12 have been offered the vaccine. It's not compulsory on the child to get vaccinated. They have to get parental consent. If the parent decides not to get their child vaccinated, they won't get vaccinated. But my earnest request to all mothers, please get your children vaccinated, because with this particular outbreak, it's also affecting a lot of children in school, because you cannot stop children mingling. You cannot stop children from moving around as well. Children are children. We know children are children. We can tell them not to do this, not to do that, keep your distance, keep this. They're going to do what they know best. They have their friends. They're going to see them after many months. So what we're trying to do is safeguard the children as much as possible. We cannot force, if you decide not to vaccinate your children, it's your choice. But it's also what we are asking, we are pleading with you is, please get them vaccinated, because this will protect your children going forward as well.
Thank you very much. Tuch, do you have any question from your community?
Thank you, Mohammed and Ayat. I think it's been really very short and precise and very clear presentations. So to members of South Sudanese that are watching outside there, this is the time for Q&A. If you have any question, please put it forward and Mohammed will help you. To start with, Mohammed, there's been a concern about the vaccine, people things and others, because as you said before, from call communities, we get our information from overseas. There have been concerns that, you know, don't take the vaccine because it can cause infertility or it can bring this to your body and all of that. So can you at least clarify and make it an answer to this concern from the community? Because I have been running similar sessions and these questions keep coming up. And there are some other few questions that I'll ask to you after this. So
thanks, Duke. That's a very good question. And we have heard this question been asked many times. And the answer is there is no scientific evidence or medical evidence to say that after the vaccination, women will become infertile. They also said that men can become infertile. So there is they will become sterile. There's no scientific evidence to support that. There have been women who have got pregnant subsequent to taking the vaccine, and there's no scientific evidence. So that's a false rumor created by some of these anti-vax. Yeah.
Okay.
Sorry,
thank you.
Another part to the question, or that was a question about infertility?
Yeah, that was the questions about the fertility. And then also another question was in regards to the strength of the current vaccines. As you have said before, that there's other vaccine that would be brought, the Moderna and the rest of other vaccines that have also been approved and they will come in here. So we want to know more about the efficacy of those vaccines. As you know that the virus is keep mutating. And at the moment now we are in it's a Delta outbreak, the virus now, and we don't know what will happen in the near future, whether there will be more variants appearing as the vaccines, as the virus keep mutating. So that's one part. Another part is there have been talks about the booster. So can you tell us more about how will the booster work? Because there's a bit of a concern in the community now that whether the boosters will be something that will be taken on a weekly or on a yearly basis, and how will the boosters work? And have they been tried somewhere that and how is it going with those trials? Because there's a bit of a concern, and people are a bit anxious that could it be something that would be taken like, you know, how we always take these tablets and all of that. So is it how it's going to work? So
thanks. I think that's a really good question. First and foremost, with the vaccines, the efficacy of the vaccines after the second dose is over 90%, whether it be Pfizer, AstraZeneca, Moderna, they all have 90+% efficiency. So they'll give you the over 90% immunity against the COVID, all the variants we have at the moment. Now, I'll give you the best example is a flu vaccine. Every year we get a different flu vaccine. What they do is they include the information required to give you immunity or prevention against new strains that came the previous year. So going forward, at this stage, all the strains that are out there in the community, these vaccines are working. So we are trying to treat what is out there at the moment. So the vaccines are effective in Australia against the Alpha, Beta, and all the other strains, and the Delta strain. So at the moment, that's the strain that's causing problems across the world. Now, going forward, like any other vaccine, the people who are working in this area are continuously working. They're going to tweak. They've got the vaccines now working. What they have to do is add the extra genetic information that is required to target the new strains as we move forward. And that will happen maybe next year. Now, and this is where you're talking about the booster shots. So what they're saying is the vaccine will work to 9 to 10 months. Roughly, that's the period they're seeing, because we are still in a very infancy stage of how long the vaccine is going to last. So in Europe and in America, the vaccine was given somewhere last year, October, November, that's where they started. So what we're seeing in UK and in Israel, as well as in America, they are starting and getting ready to give the third or the booster shot to people who have already been immunized a long time ago. So I think that's going to become part and parcel. In Australia, ATAGI, which is that body that approves all medical treatments to people, are not started on that because we are still in infancy stage. We started our vaccination program only in the middle of February. To be precise, 23rd of February was the day we started vaccinating. So remember, it was a very little people who got vaccinated in the first 2 months. Most people would have got March, April, and it's now the surge that has started since July after that fourth lockdown that people started getting vaccinated. So people are going to have immunity for some time. So come next year, hopefully we'll have four vaccines available. So people will be able to get vaccinated as well. We might have abundance of vaccines because what we have at the moment is a big supply issue. So going forward, I think we will be getting a booster shot. We might, like the flu, have to take it yearly, or that might be. We won't need to take it on a weekly basis. I don't think we want to be pincushions where constantly they're pricking us. So it will be, I think, on a yearly basis, that because that will give us roughly about 9 to 10 months of quite safe immunity, over 90%, as I said. We can never get 100% immunity in anyone. But that would be, I think, the way we would go going forward. I think everyone talks about, because they already started doing it in America. My brother and his family lives in America. They have taken Moderna. They are now, they have been told to come and get theirs. They took it somewhere way back in December or something like that. So they're getting ready to get their booster shot very soon now.
Okay, thank you so much, Mohammed. One last thing is that to all the community members out there, if you are finding it hard to get your booking, to get your vaccination, please reach out to me and I will always direct you, or call your GP and book in. There are centers now that are open, and there are plans that there will be more centers open and walk-in centers, drop-in centers will be there, whereby you can go and get your vaccine. So if you are there and you are ready to take your vaccine and you don't know where to go, please reach out to me or call your GP. And if I'll also be providing weekly updates on the new centers that are community-centered centers that will be open soon. I will still let you know where and when to go and get your vaccine. So if you are still out there, you're still viewing this video, if you have any question, please put it in the comment section, and Mohammed will respond to your question.
Just to add to that, we are listening. We understand that people are finding difficult to do the bookings, and we know that some people prefer the walk-in system. So some of the places, like even the Hume City Council, which is doing vaccination, they have both bookings as well as walk-ins. So that is, they have the mixed method systems that are adopting in some of these places as well. Yeah.
Okay, thank you.
Thank you, Tuch. And Mohammed, to follow up on the question that Tuch asked previously on the vaccine, the booster shot. Now we see many variants coming, like the vaccine, the COVID, it's, changing. Does this mean we're gonna keep having shots for all the variant, or they will keep adding more viruses to
the vaccines will be developed like the flu vaccine every year, because if you were to take the number of variants in the flu, it's beyond the numbers that of COVID variants. So they have incorporated every year. Every year it gets incorporated. About 4 or 5 new strains are incorporated, because what happens is we get the vaccine in June, July, because that's the time we have the flu. So sometimes you get a new strain that comes out. You see here of a new strain of the flu. What happens then in America, they then develop the vaccine to target the new strains that we have. So then we get that vaccine that is targeting this year's strain, and so we get it next year. So it's like we are one step behind, but we get. So I think with the COVID, they are working internationally. It's because the good thing about COVID is people are not working in isolation. Countries are not working in isolation. They're working together. The vaccines are coming from central bodies like few countries. We are also producing AstraZeneca, but the knowledge and the skill and the information is shared right across the world. So this is the good thing about COVID, that information is coming, shared knowledge, and we are working to get the best vaccine for people. Because when the Prime Minister decides to open the borders, we'll have people traveling across, both back and forth. So people could pick up a strain from overseas and bring it here. And this is what has happened in the past. Our Delta outbreak is from overseas travel. We were free of COVID. We were able to say we were 0 cases of COVID. And then all of a sudden, we are now really high up there in COVID numbers. So it is going to be, the vaccines are going to be developed. And this is the fantastic thing, that scientific knowledge is out there making things better.
Thank you, Mohammed. Another question. There is a message that's been going around, started last week actually, like 2 days, 10 days ago, coming from overseas, that someone actually in Egypt, someone had the vaccine and went to his dentist, and he died after he got the anesthetic. So people started being scared, and I would like your input on this. What is there a relation between anesthetic and dangerous if you had your shot?
There's no relationship between the vaccine and the anesthetic at all. There might be something that has gone wrong.
Yeah.
Because people can die, even in surgery, people can die due to after anesthetic. And when anesthetic comes and talks to the patient before he goes to surgery, he gives you all these reasons that can happen. But none of us say, no, we don't want to get surgery. We go and get the surgery. So it has nothing to do with the vaccine.
Yes, thank you very much. And to prove that what you're saying is right, I had a friend from my community. She had the vaccine 2 weeks ago, and she undergone a surgery on Monday, and she's okay. She's alive and healthy.
Many people who have got vaccinated have had surgery since then.
Yes, yeah. Another question from seniors. They're concerned about social isolation, and they're saying, I know it's nothing to do with you because this is government regulation, but if the senior person they're fully vaccinated and their children are vaccinated also, are they safe? Like, why is they not allowed for their children to come and visit them?
Thank you very much. Because as I mentioned, even though you're vaccinated, you can still get infected and you can still pass the infection, although it's lesser than if you're unvaccinated, you can still pass it to other people. And elderly people also have other conditions, health conditions, and the immune system also is lower. So we are trying to minimize the movement of people. I know that every one of us is feeling this isolation. We all we all acknowledge that this is a big issue. This is a big problem. Yeah. But unfortunately, I think in order to save the lives, because we want to, like last year, we said we lost about 800 odd people, mainly in the elderly place, although we didn't have vaccination at that time, but we lost about 800 odd people. So I think the thing is we are trying to prevent people getting infected. I think that's because we have heard, like I was at a forum day before yesterday, or was it Tuesday or something? Yeah. Oh no, at the Lebanese forum on Wednesday, there's a forum, Lebanese community, and one of the young people said how this young person who was infected went and gave the infection to his mother and rest of the family at home. So it was shocking to hear that. It was sad, but yes. So I think it is a protection because we don't want to lose anyone. At the end of the day, we don't want to lose anyone yes. due to COVID. We don't want to be that person who gave COVID to somebody and that person died. Because for the rest of our life, we are going to be sort of blaming ourselves. So it is that I think to protect everyone is why these rules are there. Yes. Unfortunately, it is hard. I know it's hard. I hate being at home. I love to go out.
For all the people, it's even hard.
I like to travel. I've not seen my brother and his family for 2 years or 2.5 years. So they're in the States. So it's hard. But I think it is the safety for everyone. It's not only for us to be safe. It's also to make sure our family, our friends, and our community, we have a responsibility to our whole community. We are not living in isolation. So I think that's a responsibility we take, I think, to support each other.
It's not only about us, it's about other people, the people we love and the people who are around us. Any question from your community, Toots?
Yeah, I got one question here about the insurance. If the person die as a result of COVID-19, so of COVID-19 vaccines. So what are the insurance policies around there? How what are the regulations around that? Because at the moment is when you get tested, there's something given to you, and when you isolate, there's something given to you. What about if you get the vaccines and somebody
I don't have the documentation here with me, but there was something that came out a few weeks ago, which I can send to you from the federal government. And they backdated it up to February, the time the vaccines came out. So we can send you the documentation about that indemnity and all those things with insurance. So there was something that came from federal government recently.
Okay. Okay, I'll wait to hear from you, and then I'll share it with the rest of the community members, so that everybody will be, because sometimes, with the call communities, need to ask these questions, and everybody needs to be confident of what's going on. And as you have seen, there's a lot of misinformation out there, a lot of myths, a lot of these. And so I would take this time just to thank you, Mohammed, for your time, because more of these information stations are the one that will really restore confidence in the community. And at the moment, there's a lot of response to vaccinations, even within the South Sudanese community. There are people who are really stepping up the game, and the people are responding well. And I still urge the community members that if you haven't booked in, please do. It is not yet mandatory. We're not forcing you to go and take your vaccines, but as you know, for us to come out of lockdown, for us to visit our parents again overseas, for us to participate normally like how we used to, it's an obligation now that I would say it's something that we are we are eager enough to educate the community such that we take the vaccines and we protect ourselves and our community.
Well said, Tuch. And also, I have a question now. Someone posted, if we have the vaccine, if we are fully vaccinated, and is it safe for us when we travel overseas? Like I know, like most people now, they have they're back home in their country, they're vaccinated.
Yes.
But if we catch a new strand of COVID, how would we, we respond to it?
Sorry. Sorry. I'm trying to get my. Can you see? Yeah. Can you see me? Yeah.
Yes.
Sorry. Yeah. I thought I disappeared. So yes, there are strains and some countries where the virus is like, it's a lot more cases. Let's look at our neighborhood, Indonesia, Malaysia, and all. There's so many cases. So if you were to go to and travel there, as I said, you can still get infected. So if you get infected, you're going to be in quarantine and you're going to go through the process, and hopefully you can also get the necessary medical treatment. So I think it's very important that people traveling overseas, make sure you have travel insurance, health insurance. If you go to any country you're going to, even if you're going to your home country where we came from, yes. It's important because if you fall seriously ill and you might need medical attention, you need to be able to get the best treatment as well, because you won't be able to travel with being sick. You won't be able to travel and come back until you are recovered, and because I don't think any airlines will allow you to travel if you're infected. Yeah.
Yes, thank you very much. This is very important point you raised about the insurance, because if you get sick back home and you have to stay there, you need lots of money to cover your expenses. Yeah. And I have a question. It's been asked to me like earlier, not on now, but it's about what is it? It was in my head now. It's about children.
Yes.
Again, safety for children. When they get vaccinated, would they still be like, if they get the COVID?
Yeah.
Would it still be hard on them?
If so children have been vaccinated, we have not heard many cases of vaccinated children falling sick, but this could happen. But as like in adults, if their immune system is working full on and they've got vaccinated, if they get it also, generally they get mild COVID. Not many get the COVID that adults get. Yeah. But so if they have vaccinated, then their immune system is much stronger than anyone else's. Yeah.
Yeah, the other questions, this is the one I've been asked to ask you. You mentioned before the side effect of the Pfizer on young people.
Yes.
About the heart, and some
males, especially males.
Yeah. Especially males. Does this have long-term impact?
No, there's not been, the studies don't show any long-term impact. Yeah, it's in some, again, as I said, it's very rare. So there's no, what they're seeing is because it's only been maybe a couple of months. So they have not seen any long-term impact on those people who have recovered. Yeah.
So it comes out as a side effect, but it doesn't stay with them.
So people who have recovered, they say there's not been any long-term side effects on them.
Yes.
Because it's not very long time, so we can't really say for 100% the people are not going to see this in a few months. But at this stage, they said, like I've looked at some of the papers that have come out and also studies, it doesn't say that there's long-term. At the moment, they are not like facing ongoing side effects. Yeah.
I think, Mohammed, this is one of the issues also they're still scared because it's too early to say the long-time impact, Yeah.
But what I can say this is, if you don't get vaccinated, you are going to get infected, and you could suffer more. So when you look at the two options of getting vaccinated and preventing getting a full-blown infection is much better than not getting vaccinated at all. Tuk, I'm going to share that indemnity link here. So this is the federal government link which was announced by Greg Hunt. So
I also sent it to Truchin as well in the
good,
chat.
sorry. Good. I was just while talking, I was just Googling, because not Googling, I was looking at our engagement. We put it up there, so that's it there. Good. Yes, I can see you've done it before me. Thanks, Aurora.
Thank you very much. I think if there are no more questions, maybe we can wrap up now. So
yeah, sure.
Do you have, from my side and on behalf of the ECCV community, Ethnic Communities Councils of Victoria, I would like to thank you, Mohammed and Aurora and your team for being with us and giving us those information for the community. I believe even if the person is has already have been vaccinated, it's still good to attend those presentations, because the more we attend, the more we learn. Personally, every time I've been attending every week presentation, and every time I attend, I learn more things and new questions. We hear new questions and we ask you, and we have answers for them. It's very beneficial for everyone. I would encourage everyone to keep attending any sessions they can. And thank you very much for your time. And thank you for the community, the people who attended, who joined us on Facebook. And we hope that anyone can go back and watch us on Facebook again, because this is being live and also recorded. Thank you very much, everyone. And
thank you. Thank you. Thank you to your community as well. Keep safe, I think, and get vaccinated is my message to everyone. Thank you, Hayat, for organizing this, and Aurora for sparing a Saturday afternoon as well.
Yeah, and for our IT team, okay, also. Thank you very much, everyone.